Virtual reality has a remarkable ability to create illusion for users in the virtual environment. But there are some barriers to its widespread adoption. One of the known issues is cybersickness. Cybersickness destroys the user experience and it also disturbs vital signals. To overcome this, we propose the first but stable heart rate feedback, FSH feedback, to ensure the VR users perceive themselves to be in a psychological stable condition. The concept of first heart rate feedback was introduced to elicit attractiveness toward other person. It means illusion can occur when users perceive a false heart rate as their own. Also, it influences one's cognitive, psychological, and even in physiological signals. In this context, we expect to create an illusion that makes users believe they are psychologically stable through low and stable heart rate feedback. To explore the effect, we conducted two separate experiments with three conditions. The first condition is auditory feedback, AF. Subject listen a first heart rate sound clip through the noise-canceling headphones. Next condition is the vibrotactile feedback, VF. Subject place their feet on a footstand which has a built-in woofer speaker. Note that our subject wore noise-canceling headphones, so sounds from woofer speaker did not affect the subject's experience. We also set the FSH feedbacks for the experimental setting to 40 beats per minute, which means the regular resting heart rate. Lastly, non-condition was set as a baseline. Also, we designed two distinct VR environments for each experiment. For the first experiment, we used a roller coaster VR content. In this content, vibrotactile feedback was considered harmonized feedback. Because the vibration may perceive as a friction from the roller coaster rail, but auditory feedback may not harmonize with roller coaster. For the second experiment, we designed a Whale Valley VR content. Conversely, Whale Valley VR content was paired with the auditory feedback because it is challenging to expect vibration in a watery environment. But the visible heart rate within the Whale Valley simulation may lead subject to expect heart rate sound naturally. We also designed two pre-trial contents to establish that the given feedback reflects their own heart rate. In the tension-inducing content, subject can perceive increased heart rate leading to instability. Conversely, while the relaxation content, they may feel relaxed in the peaceful forest, reading a stable heart rate. Note that we provided subject actual heart rate feedback while pre-trial contents through visual, auditory, and vibrotactile feedbacks. To evaluate the effects of FSH feedback, we used several questionnaires, including MISC, SSQ for cybersickness, and IPQ was measured for the immersion and presence. We also added several questions to measure the perceived stimulation of feedback and its perception. And subject actual heart rate data was also collected. Here are the summary of our both experiments. Firstly, the result of the level of the cybersickness. Overall, FSH feedback significantly reduced the level of cybersickness. Moreover, the effects are enhanced when FSH feedback does not harmonize with VR content. Next, the results of the immersion and presence. We observed harmonized FSH feedback significantly enhance or upholds perceived immersion and presence. Subjects also prefer the FSH feedback when it harmonized with the VR content. Third, the result of general experience. We can see FSH feedback gets the highest preference. Interestingly, there are significant correlations indicating the perceived similarity of the FSH feedback was negatively related to the level of the cybersickness. We can interpret these results within a cognitive context. This table shows the result of actual heart rate profiles. Unfortunately, no significant difference was found among three conditions. However, we observe a noticeable trend towards stabilization and lowered heart rate with FSH feedback compared to original content. In conclusion, we found FSH feedback can significantly reduce the level of cybersickness in both experiments. It's the first case of using first heart rate feedback for reducing cybersickness. Moreover, if subjects have a more belief in the FSH feedback, it leads to more cybersickness reduction. And we also observed harmonized FSH feedback upholds or enhanced the perceived sense of the immersion and presence. But heart rate data didn't statistical results, so it should be analyzed. For more details, please check out our paper. Thank you for watching our video.